Good morning. My name is Jane Turner. I'm the Executive Director at the Children's Museum of Atlanta, and I'd like to welcome everyone to our Town Square. Town Square is a virtual series designed for families, educators in the community to learn about and discuss important issues and challenges that are weighing on so many of us, especially right now. Children's museums around the country serve as town squares for families with young children, and CMA is happy to serve that role in our community. We're a gathering place where all are invited to explore, engage, and learn in the way that children really learn best, which is through play. Over the past months, we have been hearing endlessly from families and educators who are seeking meaningful conversations, information, resources, and ideas to help them navigate this really challenging time. Last month, our focus was on systemic racism in schools, and we heard from Atlanta's most respected and cherished educators who are working every day to bring positive direction and achievement to the lives of all of our children. We're so fortunate to be able to engage in these conversations and to bring some of the best and brightest members of our community to this program. In case you missed last month's Town Square sessions, they were recorded and they can be found on our blog, which you can access through our website, childrensmuseumatlanta.org. Throughout this morning's conversation, if you think of a question that you would like to ask, please post it under this video, and we will try to save time at the end to get to as many questions as we possibly can. Again, welcome and thank you for joining us. This morning, I think we can all agree that this is an incredibly unusual school year that we're beginning in Georgia. There are tons of sometimes conflicting information and different ways that schools and families are addressing teaching and learning during the COVID era. We're hearing from parents and teachers that the stress level is incredibly high. Because of that, we thought this would be a great time to include an Atlanta resource that is trusted and treasured really by every family, which is Children's Healthcare of Atlanta. And this morning, I'm really delighted to introduce you to Dr. Matthew Lynham. Dr. Lynham, welcome, and thank you for being here this morning. Dr. Lynham, I'll give him a quick intro. He's an associate professor of pediatric infectious diseases at Emory University School of Medicine and Children's Healthcare of Atlanta. He joined Children's Healthcare and Emory in 2017 and had completed his internship and residency at Cincinnati Children's Hospital Medical Center, where he also served as chief resident. He remained at Cincinnati Children's Hospital Medical Center for his fellowships in pediatric infectious diseases and quality improvement. Dr. Lynham's real passion is improving the quality and safety provided to children with a special focus on preventing healthcare-associated infections. Through his previous work, he has led institutional projects to improve the hand hygiene behavior of healthcare workers, families, and visitors. He's increased healthcare worker influenza vaccination rates, and he has reduced healthcare-associated viral respiratory infections. And all that is really important right now, and we are so happy to welcome Dr. Lynham. Dr. Lynham, I'd love to start out by asking you to talk a little bit about yourself and your work and why you thought it was important to participate this morning.
Yeah, thanks, Jane. Thanks for the invitation to speak today. I know this is something that's, whether we want it to be or not, COVID-19 just sort of remains in, sort of in the forefront of our minds. And I know that there's lots of questions out there. There's lots of information going around, and oftentimes that information, can seem like it's conflicting and therefore can lead to a lot of confusion, and that confusion to a lot of anxiety. And we've had to work through that both within the hospital setting, but I've also seen that out in the community with the schools that my children attend, and just talking with friends and other parents. But for the last few months, a lot of what I've been doing at Children's has been focused on helping the hospital prepare and manage the day-to-day operations while keeping, making sure that we keep our employees and our patients and their families safe through all of it, so we can do do the work that we do, which is take care of children, but also keep everybody safe at the same time. And just from some of that work and the fact that I've got 3 children in school, some of that experience has sort of spilled over into some opportunities just to kind of help out with some of my kids' schools and help them sort of work through some of their own anxieties and challenges that they're facing. So this is, whether I like it or not, is something that is inescapable from my life, and something that is really important to kind of help people work through.
Well, it's really clear that it's impacting everyone, you as a healthcare professional, and then also in your role as a parent of 3 children. So it seems that you can understand all sides of this, which is great. Really quickly, or not really quickly, but just, as parents are making decisions about sending their kids to school, there's so many different formats that are being put forth, in person, virtual, et cetera. What should parents expect from schools to ensure that safety protocols are in place, to ensure that their children are entering a safe environment and with sound communications in place?
That's a great question. And I think first and foremost, I think most, if not all schools have been, looking to the Centers for Disease Control and Prevention and the Department of Public Health to look to their guidance. Both of those sites have put together some pretty nice guidance and resources as to what they, some recommendations that they have that schools should try to put in place as they've been thinking about reopening. And just, from, personal experience of seeing what, some of these schools have done, I think they're doing, everything they can to implement those, those recommendations. But that's what I would, as a parent, if I was trying to sort of understand, where my school sort of fits in sort of the bigger picture of, what it takes to reopen safely, as I would start by going back to the site, sites on the CDC and the public health web pages, and just kind of look through what are they recommending that schools try to put in place. And then, go to your own school's, websites or whatever communications they've put out to get a sense of what the school's putting in place, and just get a sense of how well those seem to line up with, how well they're meshing together. I think every school and school system's different, and the requirements for different different child populations are different, given their ages and the ability of children to follow things like masking, challenges with older kids where they start changing classes and they're moving around a lot, and it's not easy to just isolate a group of kids into a small bubble or pod that they always stay in, because they're moving around. You get into larger schools where the student body population is such that it just becomes next to impossible to try to keep physical distancing sort of measures in place, just because there's so many students. And then you also get into some schools that take care of children with special learning needs, hearing impairments, where being able to see the teacher speak and the teacher being able to see the student sort of mouth the words and things like that, where seeing the mouth of the person speaking becomes really important. And those are all things that I think different schools have had to work through and have come up with different models to try to create something that works. And some schools have gone into sort of a hybrid sort of mode where the students are in person some days and not in person on other days and learning virtually, just to limit the number of people in the building as they're moving around. So, I think those are just some basics, but I think most schools are implementing some degree of, screening, daily screening of, students and teachers. They're doing some enhanced cleaning. They're doing, often doing some form of contact tracing. If someone develops symptoms or gets sick, there's often a team that's behind the scenes sort of tracking all that stuff down and sort of making recommendations of how long children should stay out of school, when they can come back. But then I think the core is what, we've been talking about a lot at Children's in our messaging, which is the 3 W's. Wash your hands, wear a mask, watch your distance. And I think those are really 3 core strategies that, people can do, anywhere, outside school, but I think also how well the schools implement those 3 things, especially, I think will really have a big determination on how well schools are able to sort of get the kids back into the classroom and stay that way. How well are they requiring masks? Are they just recommending it? How well are they able to space the children out so there's not a lot of excessive interactions between different students and things like that. I think that's going to be key, is how well schools implement the kind of the 3 W's will, I think, really determine how effective they are in being able to stay in person.
That's great. And so, speaking of masks, so wear a mask. Can you just talk to us a little bit about masks, because there's, again, who should be wearing them? Probably what age, who should be wearing them? Are there best masks? I have read that there's there have been some studies about what are the best types of masks, and if there are masks that are not effective. So basically, just kind of a little tutorial on masks would be great.
Sorry about that. Challenges of giving a webinar at home and having a student doing home learning. But to answer your question about masks, I think first is to go back to the very beginning and just kind of talk a little bit, about how masks work. Because I think in the very, what we've learned, we've learned so much about masks over the course of this, and our recommendations have changed really out of all of this information that we've learned. And, initially there was a lot of, some of the early recommendations were, you don't need, if you're out in the public, you don't need a mask. And then I think it became clear as we started seeing the impact of what happens when people wear masks and how it can really interrupt the transmission of this virus, especially in situations where we know that, people can often be contagious for a day or 2 before they even have symptoms. And so wearing masks became a very effective strategy in interrupting the transmission. And there's been some nice studies that have shown how those work, even visually showing how when you're wearing a mask, it really is, the phrase that a lot of people have said, my mask protects you, your mask protects me. When you're wearing that mask, it serves as this kind of barrier that's catching those respiratory droplets that are various sizes that come out of your nose and mouth when you're not only coughing and sneezing, but also, speaking, talking, even sometimes just breathing. Those droplets come out. And although the virus is, certainly much smaller than the holes in the mask, viruses don't come out by themselves. They're sort of sort of held in these respiratory droplets. And as you breathe them out, if I'm just breathing them out like I am now, some of those those droplets of various sizes will evaporate down into smaller particles that can hang out for, extended periods of time and then sort of drift down to the ground. Whereas the larger droplets sort of drop off more, settle out more quickly. But wearing a mask, and that if you think about just breathing in and out of a mask, that space between the mask and your face, because your breath is moist, the air there is very humid. So those particles just between your mouth and the mask don't have that time to evaporate. So they're much more readily caught in that mask and don't make it beyond. And that's really how masks help in sort of interrupting and significantly reducing the number of droplets that are getting from you sort of beyond that barrier of the mask and potentially getting to other people. And there's been a number of studies. We've seen it in healthcare, when healthcare settings have gone to universal masking, where all, not only all employees, but also, patients, families, everybody's wearing masks. When those sort of measures were put in place, we really saw a significant drop in the number of healthcare workers that were becoming ill with COVID-19. There's also been some nice studies in the community. There was a great report by the CDC that highlighted this event where there was two hairdressers that were working. One of them had some mild symptoms, ended up, infecting the other person. They both initially didn't think what they had was an actual mild illness, which we often see, but ultimately it ended up they actually did have COVID-19, but because they weren't aware of it, they continued to work. And over the course of about a week, took care of over 130 different clients, cutting their hair. As you can imagine, you're standing right over somebody. You're often there for at least 15 minutes. So that would definitely be considered a real potential exposure, especially standing right over somebody, cutting their hair. But their policy was that all the staff, both these hairdressers were wearing masks the entire time, as were all of their clients, and no one became sick. And I think this has just been a really great sort of exemplifying sort of case study of the effectiveness of masks out in the community to interrupt transmission. So I think masks really, we've learned a lot, and masks really do serve as a great way to interrupt the transmission of the virus between people. There was another study that just came out just in the last couple of weeks from Duke, where they took a bunch of different types of masks, everything from an N95 respirator all the way down to like bandanas and these fleece balaclava things that people are wearing to help, as different types of kind of community face coverings. And they found that, not surprising, not all masks are equal. Certainly the N95 respirators are sort of the gold standard in their ability to sort of keep particles from, sort of getting beyond, the person and out into the air. But these, surgical masks that we're often using in the hospital are almost as good. And what they found is even some of the cloth masks that people are using often have very similar effectiveness in their ability to sort of catch those droplet particles that are coming out of people's noses and mouths. What they did find, though, was that bandanas and some of these fleece gaiters, like bandanas are, much worse, but a little bit better than nothing at all. But some of these like fleece gaiters are actually worse than wearing nothing at all. And the thought is that they're almost sort of like, shredding these larger, instead of catching the respiratory droplets, they're actually shredding them into smaller particles. So they're actually making more particles. So not all masks are equal, but most of the cloth masks and procedure masks that are out there are very effective. The other masks that I would sort of steer people away from are a lot of the masks that have these sort of exhalation valves on the sides or in the front, because many of those aren't filtered. So as you can, the purpose of a mask is to catch your exhaled breath. And if you have an unfiltered exhalation port, you're really defeating that purpose. So, and that's why a lot of places, everywhere from Atlanta International Airport to our own institution, have sort of effectively banned the use of those in our facilities, because they you know, potentially don't do what they're supposed to do at all. They're great for like working in construction where you're trying to sort of filter things that you're breathing in, large dust particles, but they're not good for what we need for trying to keep the respiratory particles.
Well, that's really good to know, because it's as people are working to do the right thing for themselves and the community, it's good to know which ones aren't effective so that you can make smart choices. The other thing that we're hearing families ask about are, so many families, probably almost every family, have children who have always been engaged in sports, whether it's soccer or baseball, also scouting and other activities. One of the questions we've received a lot is, how do families decide if activities such as these can be done safely? What are some of the things families should be considering when making decisions about really activities outside of the classroom?
That's another really good question, and it's been one that I think every family has struggled with, is sort of how you balance, because a lot of these activities are core to who the child is. I mean, it's something that's an important part of their identity. Sports, there's lots of great benefits with sports, physical activity, getting kids off of like, screens and out, from in front of video games. But also the social interactions, the learning to sort of function as a team. Those are all great benefits. And sort of how do you balance that with sort of the very real risks of like, sort of kind of adding to the number of, sort of interactions that you're having with other people, especially sports. It's often not, it's not feasible to wear a mask while you're playing the sport. So what's the risk, and can you do it safely? And I think that's again, I would sort of urge people to go and take a look. I know there's some information on children's websites, sort of with some guidance about sort of looking about reentry into playing sports. There's also some guidance on the CDC website with similar sort of recommendations of how to sort of think through sports. Not all sports are the same. Some sports have it's very hard to socially distance. There's much more sort of close and prolonged interaction between the players, whereas some it's much more spaced out. And so the risk for different sports varies. The type of activities of those sports, whether you're just doing practice or you're playing games just within your club in your local area, or are you starting to pull in playing games with teams from other parts of the city or region? Or are you even doing like travel sports where now you're required to travel long distances, stay in hotels, eat in restaurants? Those are ever escalating potentials for risk and exposure. And I think every family needs to sort of look at not only what are some of the guidance from bodies like the CDC and public health, but then also look at the specific recommendations and processes that each, whatever club or activity your child is potentially going to be involved in, and take a look, what are they going to be doing to try to keep the kids safe? And again, I think it, very simply goes back to how are they implementing the 3 W's? How is this soccer team, doing things like wash your hands, wear a mask, and watch your distance? How are they implementing those things to keep the kids safe during those activities? And I think each parent has to look and say, are the processes that this club has in place something that I feel like they're reducing the risk enough that I feel comfortable with my child engaging in this activity? And I think that's is somewhat of a family to family decision. But I also think it's important to keep in mind that from a school's perspective, the school itself is not is not in isolation. A school can have all of these great processes. They could have spent all summer working so hard, having all these great processes in place to, have kids wear masks and, physically distance them and, increase their cleaning and do all of these things. But if the community, the school community, the families and the students don't sort of aren't sort of engaged outside the classroom, all of that can unravel very quickly. So I think it's also important to keep in mind the fact that as a parent, students that may be doing in-person learning, what we do outside the classroom also matters. And if, our children are engaged in, higher risk activities and potentially become, exposed, infected with COVID-19, that ultimately trickles over into the school and can result in, other people within the classroom being quarantined. And if enough of that's going on, requires school to go back to all virtual learning. So I don't say that as to tell families don't do sports or anything like that, but just to sort of, while it is important to sort of look at these recommendations and make sure that they are, reasonably safe for your child to interact, to sort of engage in that activity. Also keep in mind as your role as part of the larger community and your child's, school community, and make sure that you're not, having your child do things that could potentially ultimately jeopardize the ability for the school to stay open as well.
I have actually a question that came in from someone who's listening. The question is, what about sending a toddler to preschool when there's a newborn baby at home? The toddler needs and wants socialization, but the parent is worried about the newborn and what happens in that scenario.
That's a good question. Again, I think it depends on what sort of processes the school has in place. I think, it's what I've seen in sort of one of my own kids' schools. I've been really pleasantly surprised at how young kids are that are able to sort of participate and wear masks all day long at school. It's really, I've been really pleased at how well kids have sort of risen to the challenge and sort of, joined in and are sort of doing their part to sort of keep everybody safe. But when you get down, below like kindergarten, it admittedly gets pretty difficult to try to get kids to wear masks for an extended period of time. So, when you're down in the toddler range, that doesn't work as well. And I think the strategies that a lot of schools and, daycares and things like that are doing, in situations where you can't necessarily keep a mask on the kid is, trying to limit, those, the pods, keep that, those classes small and sort of as independent from the other groups as possible. So there's not as much cross reaction or crossover between, one small group of kids to another small group of kids. Usually parents are, wearing masks, and not parents, but teachers are wearing masks. Strategies just to try to limit the potential of infection in that toddler. And then I think, the things at home, having, the toddler, when they come home, make sure that they wash their hands. It's probably a good idea to just, once they get home, have them change out of their school clothes into, some different clothes. I'm not saying, strip them down in the garage or throw them in the shower or anything like that, but just, I think it's good practice, once they get home from school, wash their hands, change their clothes, make sure that, and it's always good practice, whenever, a child is going to interact with, an infant sibling or anyone to interact with a newborn, that they should wash their hands before touching the child, and that, no one with any sort of ill symptoms should be, interacting with an infant just to protect them. But I think those are not, don't sort of completely remove the risk, but I think they do sort of limit it, can get it down to sort of a much more, small, reasonable level.
Well, thank you. This is, there is so much to talk about. I don't even think we're going to get to all of it today, but I would love to, because we've got just literally a minute left, but I know that you brought sort of a resource list available, and I thought it would be great if you could quickly just walk through what you brought. Again, we're down to about 30 seconds, but just to let everyone know, this will continue to be posted. So
yeah, most of these are, I think, websites that people can easily get to. I would certainly, some key places to send families. This is just a screenshot of the homepage for Children's Healthcare of Atlanta. There's a coronavirus hub that for parents and has all sorts of resources for them. Everything for how to take care of their child and prevent transmission, and thinking about school and sports and all of those things. Those are all, and even if some links to places where if they need to have their child, if they want their child to be tested, some places around the city that are doing COVID-19 tests in kids. This is another site within Children's that has some additional resources. But I would sort of turn people to the CDC page on COVID-19. There's lots of great resources, lots of great information there. That's where I go. That and the Department of Public Health, those are the sites that I go to look at their guidelines and recommendations. So, I mean, they're sites that, we as healthcare professionals trust. And they have lots of resources that are written sort of in, sort of non-medical sort of terms that are easy for, anybody to understand. So I would certainly turn people there. And then Children's is on, I think all the social media platforms, and those are certainly other places to link up and, ask questions and ask for help. So I hope, for all the families out there that are trying to sort of navigate through all this, I hope that this has been helpful in answering some questions, and hopefully these other sites and resources will be useful as everyone's trying to sort of figure out how can I keep, my family safe, and how can I potentially, get, sort of reconnect and re-engage in life, because, COVID's going to be here to stay. I think we can't stay all, bundled away and, sort of socially reclusive from everybody else. We have to find a way to kind of get out and get back in, into life. It's just, we have to do it. We're going to have to do it a little bit differently in order to allow it to be done safely. But hopefully some of the things that we've talked about today will kind of help out as families are trying to kind of figure out how best to do that.
Well, Dr. Lynham, thank you so much. And really, again, we're so grateful to Children's Healthcare of Atlanta. Good folks and doctors there helped us at the Children's Museum determine protocols that would make a visit here healthy. We turn to you for these types of questions because of the excellence and the fact that you were so trusted in our community. But thank you so much for being here today.
My pleasure. Thanks for having me.